Okay, this is the sexual dysfunction recording for Unit 1, and this is part 2. So starting off here, we're going to talk about fibrocystic breast changes. What are fibrocystic breast changes? So this is going to be changing in that density of the breast. This is what some people used to refer to as lumpy breast. It used to be well-known fact, if you had lumpy breasts, you were going to get breast cancer. That used to be the thought process. Over the last 5 years, they've discovered that, along with a lot of other things in healthcare, that's not necessarily true. What is fibrocystic breast changes? These are non-cancerous changes in breast tissue. These usually happen around the age of, or between the ages of 30 and 50 years of age. They think that it's probably due to some hormonal changes during cycles. And the pathophysiology. So with proliferative fibrocystic breast changes, you can have an increase in cell numbers, and with the increase of cell numbers, you're going to have an increase of maybe developing breast cancer because there's more cells than there used to be. And then you have the non-proliferative fibrocystic changes. These are fibrosis of connective tissue, cyst formation, and inflammation, meaning this can be a monthly thing for people that they're just going to have these kind of lumpy, maybe uncomfortable breasts that week after their menstrual cycle, they feel a lot better. And then in a couple of weeks, it starts to develop again. Maybe it's only a couple of times a year, something like that. It is important to educate, this does not mean breast cancer. And then how do we know if it's proliferative versus non-proliferative? They're going to have an MRI or a CT with contrast in order to see what those cells are actually doing and looking like. So there's a picture of, I know it's not the greatest picture of fibrocystic breasts, showing like the normal tissue, what it looks like, and then showing what the fibrocystic breast looks like. That it's the tissues are starting to harden. You have those fluid-filled sac formations or fibrocystic cysts forming inside the breast tissue. Clinical manifestations, so can have breast pain, like I talked about, or tenderness or a sense of fullness in the breast. You can have lumps. Lumps are usually going to be movable, meaning that they're not fixed, that they can be, kind of pushed and rolled around. They're going to have regular defined edges, meaning they're going to feel round. You're going to be able to feel around the lump to a certain extent. If it's jagged, pointy, irregular in shape, really bumpy, then those are kind of more bad symptoms that this lump could be cancer. But if it's nice, round, movable, then usually it's going to be a cyst. There are fluid-filled mass, sometimes that there is nipple discharge with them, depending on where they're at in the breast. And they tend to increase just before menstruation. So treatment managed symptoms, there's all kinds of different things that we can do out there. Just wearing a good supportive bra, avoiding caffeine and chocolate during this time, quit smoking, mild analgesics like over-the-counter ibuprofen or Tylenol can help, warm or cold applications, whichever makes it feel better, and vitamin E has been known to help with this. And then, like I said, just a lot of education that this does not mean that you're going to have breast cancer. It's not that thought process anymore. Menopause. What is menopause? Menopause is when menses are no longer present. You are not considered menopause unless you have gone 1 year without a period, without menses. So perimenopause means that time prior to menopause. This is where you're going to have periods that are just going to be irregular. If you were a person that every 28 days you got your menstrual cycle, now this is a person that, it's going to skip a month, maybe 2 months, maybe it's only going to last 2 days, maybe, the flow is going to be significantly decreased, something like that. Those changes are going to start happening. We call that period perimenopause, and it's also characteristic of decreased estrogen production. Surgical menopause, this is when ovaries are removed prior to the body naturally going through menopause. So if you remove ovaries, you're going to remove those hormones that used to, that used to communicate to the brain that, hey, it's time to start that, that whole menses process and get ready to have a baby. That's gone. Those hormones are gone. That communication is gone. And so that's called the surgical menopause. So effects of estrogen on the body, you can see in this picture here, the brain, it helps to maintain body temperature. So that's why you hear with people going through menopause or after menopause that they have hot flashes, because their brain is not maintaining the temperature of what it's supposed to be doing, and they are actually getting hotter than usual. It can have different things happening with breast tissue. With ovary, it stimulates a menstrual cycle. Bone, it helps to preserve bone density, and uterus, it starts the maturation process of the uterine tissue in order, like if the person was to become pregnant, for a good lining for the egg to kind of fall, the fertilized egg to fall into. All right, manifestations of menopause. So there's an overall decrease in body hair. So this is where, leg hair tends to decrease, armpit hair, hair on the arm, other areas, hair may thin on their head a little bit, not have as much volume to it, that kind of thing. A decrease in breast tissue, subcutaneous fat and vaginal lubrication can also decrease. Skin becomes less elastic. So it kind of starts sagging. It gets a little more wrinkled, that kind of thing. Vasomotor instability. So these are those hot flashes, night sweats, can cause palpitations where you feel like your heart's really pounding out of your chest, and headaches. Increased vaginitis. We talked about, there's not as much vaginal lubrication, so that can make a person feel very uncomfortable. And dyspareunia, can't say that right. Dyspareunia, which is pain during sexual intercourse. And then irritability, anxiety, insomnia, difficulty concentrating, and depression. These are all signs and symptoms of menopause. Okay, hormone replacement therapy. So, one of the things that's happening with with menopause is less estrogen is being replaced. One of those things that a doctor may prescribe if your symptoms are too much is going to be replacing that estrogen. So hormone replacement therapy tends to decrease the signs and symptoms and some of the risk associated with decreased estrogen. Benefits include decreased symptoms, those hot flashes or the night sweats might be decreased a little bit, decrease of bone loss, hopefully a decrease in osteoporosis, and a preventative of colon cancer. Risk. So with the risk of taking hormone replacement therapy, you can have nausea, vomiting, weight gain, breast tenderness, vaginal bleeding, especially with intercourse, fluid retention. So you're just gonna, you feel kind of bloated kind of thing. Increase risk of breast, endometrial, and ovarian cancer, and blood clots also goes up. Selective estrogen receptor modulators, or SERMs, they act like estrogen, but they decrease the risk of breast cancer and osteoporosis, but do not decrease the manifestations of menopause. All right, so here's good effects and bad effects that I had just talked about with estrogen replacement therapy. They also have some cholesterol benefits there. We want to lower the LDL. The LDL, if you want to remember, is lethal. Those are the bad cholesterol. HDL, happy. You want to keep the happy cholesterol up. So HDL, and then removing those menopausal symptoms. Treatments of menopause, review complementary therapies and nursing implications for hormone replacement therapy. You want to look at classification, action, nursing implications, and teaching in your book. And then we'll also review some contraceptives here in another PowerPoint. Okay, looking at PMS. So PMS is premenstrual syndrome. It is not a disease, but a response to hormonal changes that are happening in the body. It can cause emotional and physical symptoms on a monthly basis. This can be so severe, and it needs to be in order to get the diagnosis, so severe that it interferes with job, life, parenting, other big things that are happening within your life. Risk factors, over 30 years of age, already having some existing depression, and then an increase of life stressors. 3 to 8% of people diagnosed with PMS have significant disability. They cannot function because of their PMS. And then if it is truly, to a point where, we almost have like psychosis going on, that people just are not themselves, cannot function. They can get diagnosed with premenstrual dysphoric disorder, which is PMDD. And they usually do respond pretty well to antidepressants. And the DSM, for diagnosis, that just means that this is actually considered a mental health issue and not necessarily a reproductive issue. So there's a picture there that shows, some different things that can go on with PMS and be affected with PMS. So, really we're going to need to treat the symptoms. So if they're having, those GI symptoms of constipation, nausea, or vomiting, we're going to treat those symptoms. If they're constipated, we're going to look at, increasing water, fiber, exercise, maybe a laxative if it's really bad. With nausea, we're going to look at some anti-nausea things, antiemetics. If it's a lot of cramping or that kind of thing, we're going to try, over-the-counter ibuprofen, things like that. Diet, so looking at different diet changes, limiting caffeine. Other lifestyle things will be, decrease or quit smoking, and relaxation and stress management. For medications, like I said, you have those antidepressant therapies. So Danocrine, it's DANOCRINE, is one of the medications, as well as Prozac, Zoloft, and Pax. Sorry, we skipped ahead a couple of slides here. Let me go back. Okay, dysmenorrhea. So what is dysmenorrhea? This is pain associated with menstruation. This is going to be severe menstrual cramping. 45 to 90% of women will have these symptoms at some point in their life. It is caused by uterine contractions that are so severe that it's causing the tissue to become ischemic with all the pressure, and that is what's causing the pain. Other symptoms, headache, nausea, vomiting, diarrhea, fatigue, and breast tenderness are very common. Childbirth tends to decrease the incidence and severity of symptoms. One of the causes of muscle or the uterine cramps is going to be something called prostaglandin synthesis. So with these prostaglandins, what they do is they contract smooth muscles. So that's why you have diarrhea usually with severe menstrual cramping, is because this prostaglandin is going to make those smooth muscles as well contract. Primary dysmenorrhea, this is going to be no cause. So it's just they have severe cramping with their period. Secondary is going to be with some kind of underlying cause, either endometriosis, fibroids, pelvic inflammatory disease, or ovarian cancer. Middle schmerz, this is what we call pain with ovulation, and it's usually tending to be on like one side or the other. And then treatment, find the cause, manage the pain. If there is no cause, then we're going to look at managing the pain. Decrease salt, sugar, caffeine, and alcohol, increasing fluid, increase protein, calcium, magnesium, vitamin B6 in the diet, and then relaxation, rest, and exercise. Warm pad to the abdomen and other complementary therapies can be very valuable. One other medication I would like to talk about is over-the-counter ibuprofen, because ibuprofen is considered an antiprostaglandin. It will inhibit the prostaglandin synthesis, so really toning down those contractions. So there's a picture here that shows the menstrual cycle. So you have different hormones in the body, and they all have different functions. So the primary function of hormones is to communicate different things to different things in the body. So the ovary wants to start with, hey, I think it's time that we start this reproductive cycle. Let's get a menses, cycle going. So the ovary starts excreting a little bit of the estrogen in order to get that party going, and then they'll also excrete a little progesterone later on during this cycle. But the purpose of the estrogen is to signal to the brain when it gets to a certain level that, hey, we're ready. And so the brain has an overall picture of what is going on in the body. And so if health and wellness and all of that is going well, the brain will then start excreting hormones like the follicle stimulating hormone and the luteinizing hormone to tell the ovaries, hey, we got your message. We're good for launch. Let's go ahead and get this menstrual cycle going. So then the ovaries start excreting hormones that the uterus is actually going to start accumulating tissue and get ready in case a fertilized egg does implant into the tissues. Then